Welcome to this video on hypertension, a condition commonly known as high blood pressure. Hypertension is defined as persistently high force of blood against artery walls. This increases the heart's workload, leading to arterial damage and organ complications. It is often called the silent killer because it frequently has no symptoms. Blood pressure is measured in millimeters of mercury, or mmHg. It has two components: systolic BP, the pressure during heart contraction, and diastolic BP, the pressure during heart relaxation. Normal blood pressure is approximately less than 120 over less than 80 millimeters of mercury. The definition of hypertension varies slightly by region. In the USA, it is defined as systolic BP of 130 millimeters of mercury or greater, or diastolic BP of 80 millimeters of mercury or greater. In Europe, the thresholds are 140 millimeters of mercury or greater for systolic and 90 millimeters of mercury or greater for diastolic. Hypertension affects about 50% of adults in the US. It is a major risk factor for serious conditions like heart disease, stroke, and kidney disease. There are two main types of hypertension. Primary hypertension has no single identifiable cause and is related to genetics, age, and lifestyle. Secondary hypertension is due to an identifiable cause, such as kidney disease, endocrine disorders, or certain drugs. Special types of hypertension include white coat high in the clinic only, masked high at home only, sustained always high, and nocturnal when BP rises during sleep. Hypertension is usually asymptomatic, and many patients are unaware they have it. Severe hypertension, however, can cause symptoms such as headache, dizziness, chest pain, and vision changes. A hypertensive emergency occurs when blood pressure is 180 over 120 millimeters of mercury or higher, along with symptoms like stroke signs or chest pain. This requires immediate medical attention. Key risk factors for hypertension include increasing age, family history, obesity, high salt intake, physical inactivity, smoking, and excess alcohol intake. Secondary causes include medical conditions like sleep apnea and renal artery stenosis, as well as substances such as NSAIDs, steroids, oral contraceptives, alcohol, and nicotine. Complications of hypertension can be severe, involving cardiovascular issues like heart failure and stroke, as well as neurological effects like cognitive decline and dementia. Hypertension can also lead to chronic kidney disease, vision loss from hypertensive retinopathy, peripheral artery disease, and erectile dysfunction. Hypertension is common, silent, and dangerous. Early detection and control are vital for preventing complications, with the best management involving both lifestyle changes and medications.